Cervical cancer is most frequently diagnosed in women between the ages of 35 and 44. It rarely develops in women younger than 20. Many older women do not realize that the risk of developing cervical cancer is still present as they age. More than 20% of cases of cervical cancer are found in women over 65.
Cervical cancer is one of those dangerous diseases that affect women. About 7,000 women annually in a year die in Uganda because of cervical cancer. Cervical cancer is a killer disease. When I say killer disease, is because women have not taken an initiative to go and test for cancer of the cervix, and yet it is a disease that takes time to manifest in the life of a woman. Signs to look out for cervical cancer include vaginal bleeding. Usually this happens after your periods or when you don't expect periods. You get bleeding from your vagina. There is also painful sex as one of the signs and symptoms of cancer of the cervix. There is also lower abdominal pain. Of course, when I talk about these signs and symptoms, they don't primarily mean that you have cancer of the cervix. But what you need to do as women at home and ladies at home, you need to go and visit a doctor to really rule out that what really is bothering you is cancer of the cervix.
According to Innocent Kaita, a public health practitioner, virus strains of the human papilloma virus, a sexually transmitted infection, play a role in causing most cervical cancer.
Cancer of the cervix is usually transmitted through sexual intercourse, especially when the sex is not protected. That is when you don't use a condom, and also when you have multiple sexual partners. These are also one of the factors that increase your chances of contracting HPV or cancer of the cervix. The other factors include smoking. There are women out there who do smoke, and this really increases your chances of contracting the HPV or contracting cancer of the cervix. The other factor is inheritance. As a girl or as a woman, you could have a relative who really suffered or died of cancer of the cervix. So this puts you at a higher risk of contracting cancer of the cervix. The other factor also that increases your chances of contracting cancer of the cervix is consistently using hormonal oral contraceptives for over 5 years. This also puts you at risk of contracting cancer of the cervix.
One can reduce the risk of developing cervical cancer by having screening tests and receiving vaccine that protects against the infection.
How to prevent yourself from contracting this? Of course, doing away with smoking. There are quite a number of ladies who really feel okay to smoke but do away with smoking. The other factor is, of course, reduce on your sexual partners and also use protection methods like using a condom. This also reduces your chances of transmitting or getting infected with HPV that causes cancer of the cervix. However, the girls between 9 to 15 years have a chance or stand a chance to be vaccinated against HPV, the virus that causes cancer of the cervix. The government facilities have this program, so it is very important that women and parents out there and guardians take this initiative to take their adolescent girls for HPV vaccination at either the schools or either from their homes to the facilities to go and receive the HPV vaccine.
When exposed to the infection, the body's immune system typically prevents the virus from doing harm in small percentage of people. However, the virus survives for years, contributing to the process that causes some cervical cells to become cancer cells. Worldwide, cervical cancer is the fourth most frequent cancer in women, with an estimated 600,004 new cases in 2020 of the estimated 342,000 deaths from cervical cancer in 2020. About 90% of these occur in low and middle income countries. Anselm Ojaru, live at 8.